LASIK's always a two-step process, and it's the first step that nobody likes to talk about. The first step of the procedure is to make a flap on the front surface of the cornea. Now there's a reason we have to do this. The front layer of your cornea is a protective skin cell layer known as epithelium. The great thing about epithelium is that that is a regenerative layer. That's not so good for trying to permanently correct your vision though. If we were to reshape your cornea starting with the first layer, in just a few days we'd be right back where we started. So instead, what we do is make a flap, so that we can get past the first layer to the next layer. This next layer of cornea is called stroma, and stromal tissue is not regenerative. It does not grow back. So the changes that are made to this layer are permanent changes. That is how we go about permanently correcting your vision. There are a couple different ways we can go about making that flap. Now, several facilities in town are still using older technology to make that flap, a bladed instrument known as a microkeratome. Microkeratomes utilize an oscillating blade to make the flap. Here at iLASIK Austin, we believe in using the absolute best in technology for our patients. We're one of the only centers in Austin that utilizes the latest in femtosecond technology with the IFS laser. The IFS is a laser used to make the flap rather than a blade. Once in the surgery suite, we will lay you down on a bed and begin by numbing the eyes with some eye drops. The drops we use work on contact and will keep your eyes numb for the duration of your procedure. You'll be placed under a microscope where you will see a target light. Your instructions are to look at that target. A mark will be placed on your cornea by your surgeon, and a suction ring will be placed under your upper and lower eyelids. Your surgeon will say suction on, and I will apply suction pressure to your eye. When the suction is turned on, there are two things that you will notice. First, your vision will go dim or even dark during this part of the procedure. While scary if you don't know what's coming, that is perfectly normal and will not be a surprise. We will coach you through each step. The second thing you may notice is a dull ache or a pressure sensation during this portion of the procedure. Again, this is perfectly normal and will only last for a few seconds. If you feel pressure, your normal instinct is to squeeze or close your eyes, but we will be instructing you to simply keep both eyes relaxed and open. At this point, we will swing you in your chair underneath a different microscope. This microscope is attached to the laser that we're going to be using to make the flap for your procedure. As the laser begins to do its work, you will have no sensation of it working at all. You will not see, hear, feel, or smell the laser as it is firing. It takes less than 15 seconds for it to make that flap. The laser works by causing a reaction to happen, which results in a layer of bubbles at a very precise depth in the cornea. This layer of bubbles separates two layers of the cornea, forming that corneal flap.